You're looking to book an eye exam and you're confused as to what technology should be used and specifically what should be used to take the picture of the back of your eye during a routine eye exam. My name is Dr. Shawn Moore and I'm an optometrist at Orillia Optometry. So we're going to talk about the three most common ways to take an image of the back of your eye. The first is an Optomap. It's probably the most common wide field retinal imaging device. The second is a retinal photograph. And the third is the OCT. And to give you a hint, they're all important. And at Orillia Optometry, we have all three. But which one have we decided to use during your routine eye exam from a screening perspective? And a little spoiler alert, I am standing right beside the Optomap machine right here. So that is our device of choice. What you see on the image here is a picture as it comes from the Optomap of the back of the eye. This image covers 200 degrees of the eye, or about 82% of the retina in a single image. It does have some other tricks up its sleeve. It can separate deeper layers of the retina versus surface layers of the retina. It does what's called autofluorescence, which can show us darker areas of dead retina and brighter hyperfluorescent areas of stressed out and sick retina. So all of these things can be used from the Optomap to help with diagnosis during your regular eye exam. Now, if we compare that to the other two, and if we look at a retinal photo, so here's that same image that we took with the Optomap, but overlaid on that in color is the area seen by a retinal photograph. And you can see that it is far less. We're about 45 degrees of the retina, or about 15% of the retina at a single time. So again, we have the Optomap. We actually use retinal photography very little here because the Optomap is much superior. There are certain things that a retinal photograph is really, really good for, but we think from a screening perspective, seeing more is better. And then if we look at the OCT, well, if I overlay what an OCT looks like on that same image, you can see it actually sees far less than even a retinal photograph. Now, an OCT is an incredible device for very specific disease processes. And we use it every day here at Orillia Optometry. So very, very important, but we don't think it's a great screening tool. So now let's look at this in real life. So this is an actual patient from Orillia Optometry. Here is their Optomap image. I have outlined in yellow a retinal detachment. So this patient came in for a routine eye exam without any symptoms. And on the Optomap, we were able to find this peripheral retinal detachment. If we had had a retinal camera and taking the retinal photo, we would have missed that retinal detachment. And if we had done an OCT, again, we will miss that retinal detachment. So this is just another example of why that we think that an Optomap is a very, very important part of routine eye care during your regular eye exam. So we have chosen an Optomap as our screening device over retinal photos and over OCTs. But remember, we have all three. So when you need a very specific imaging technique, we have that. We hope to see you at Orillia Optometry.